technology is our future, right? So whether it's, intraoral scanners or 3D printers or, design services, I mean, technology is taking over our world, right? Not just in dentistry, but in everything. And so for us, we have a chairside mill that we've had on the market for 4 years now. We have been selling and continue to sell the iTero scanner as, a partner to our mill, but we were really looking for another partner to work with who could make a more integrated system for us. So, digital technology, like I said, intraoral scanners are the easiest way for dentists to get into, digital dentistry, right? So it's much easier to buy a scanner and start your journey that way than to buy a scanner and a mill, right? Taking on a mill is a whole nother change in your workflow, and you have to prepare for that because the way you appoint your patients is going to look different with that type of technology than just digitally scanning your patients. So, we were looking for a partner who would private label a scanner for us. So the scanner is called the Glidewell FastScan.io, powered by Medit. So it is branded with Glidewell's name. We've also done a lot of co-development with them. So it is heavily integrated with Glidewell Laboratories. So it's certainly an open platform. You can send it to whatever lab you want to. So if you want to work with the lab down the street who takes digital scans, absolutely. That's not our intent is never to lock somebody out into only using Glidewell, but our intent is to make it easier for those customers who want to use Glidewell to make it as simple and seamless as possible. So, doctors know if you've got an intraoral scanner, you enter your information in the patient information in the scanner. And then basically when you go to your lab portal, you have to re-enter a lot of that information again, and then some additional information that the lab needs. And even with that, the lab still can miss some of the critical information that they need. So what we've done in our Medit partnership is to really make that seamless. So you enter all of the information at the scanner stage, and it just pushes everything over to the lab to Glidewell directly. So you're basically filling out an online RX before you even begin the scanning process. So then you don't have to re-enter everything on the back end to send the scan to Glidewell. So, in our minds, technology is the wave of the future. We invest a significant amount of it. On the scanner side, like I said, we did some co-development. So Medit did development. We did our own co-development with them. We have our own design software that we've used in our lab, and we use for our chairside system. So doctors who do purchase our mill, that is all Glidewell enabled design software that we have, done a ton of work on that. Obviously, we make several million crowns here, and so we've got a lot of that data that we can now use, and that automatically generates a crown proposal to a doctor, in under a minute. So then they can do some final touches if they want to, but most of the time they accept the proposal and go straight to mill the crown. Like I said, we use that technology in our office every day. So every day, our software developers and our neural networks are constantly improving those crown proposals. And so what a doctor would use chairside is exactly what we use in our lab. So what you could get chairside is what you would get from Glidewell Laboratories at the same time.